What's up, sports med students? On we go to the evaluation process. So again, this is kind of just like the principles of athletic training class. So we don't get super in depth to the evaluation process. We stay kind of superficial, and that's all we really need to do right now. So we'll go through these steps and go from there. So there's two main types of evaluations. There's on-field and in-clinic. So on-field, got to be quick. You need to determine severity, and it needs to be accurate, right? We want to know if do we need to call 911 right now? Do we need to can we get them up off the field? How serious is it? And then the in-clinic takes a little bit more time, and this is the one we're going to focus on. So here are the evaluation process steps. So, and these happen in order, right? You don't want to go out of order here. So history, observation / palpation, range of motion, strength, special test, diagnosis, and treatment plan. Okay. Couple things you'll hear me repeat with this is when you do evaluations with different steps, you always want to do it bilaterally, which means you check both sides. Always need to do things bilaterally, right? So you check the healthy side and then the other side, and that way you know what's good and what's not. That's the first extra credit for today. So you always want to check bilaterally when doing an evaluation. So first step, history. So a history is just that. You're trying to get a history of the injury. And if you get a good history, you can have a good idea about what's going on with the athlete before you even lay hands on them. So we're trying to figure out what happened, how, when, and why. But you want to make sure to not jump to conclusions. It's real easy to jump to conclusions with a history, right? If an athlete starts to tell you certain things, you could just jump to a conclusion, but don't do that, right? We have to do a thorough eval. So you want to ask open-ended questions, right? Those are the good questions. Where does it hurt? Not does your ankle hurt, right? Because all they say to that is yes or no. But with this, they could expand on. So which movements increase your pain? What makes it worse or better? How did it happen? The MOI, right? The mechanism of injury, that's important. What kind of pain is it? And so on. Asking open-ended questions. Questions to start. Where are you hurting? Please point with one finger. How did this happen? The MOI, right? The MOI is a big thing, right? When did this start? So there's two main types of injuries. There's acute injuries and chronic injuries. Acute injuries just happen. Like an acute injury to a ligament is a sprain. A strain is to a tendon or a muscle. Where chronic, it's been going on for a while, right? Like a tendonitis, shin splints, right? That sort of thing. That's more chronic. Current questions: did you feel a pop or a crack? Almost every time somebody's torn their ACL, if they felt a pop, they've typically, if they felt a pop, their ACL is torn, right? What kind of pain? Dulls, chronic pain, sharp could be acute pain, tingling pain could be a nerve pain, and daily activities. Can they do daily activities like put their shirt on, wash their hair, that sort of thing? Past medical history is important. If the athlete's injured something before and they've re-injured it, they probably know what it feels like, what happened, and what we can do to proceed to make it better. Next step, observation. So observation technically could start as soon as you see the athlete, right? But it starts after you take a history. So things you're looking for. So erythema is redness of the skin. Ecchymosis is bruising, inflammation, swelling. Technical term is edema. Effusion is joint swelling. All right. Always checking bilaterally, right? So here we see a deformity, even some erythema, right? Some redness of the skin. So look, this right here, so you can still see the outline of the patella. So that's effusion, because effusion's in the knee joint. If it was edema, you wouldn't be able to see the patella. There's some ecchymosis. History, observation / palpation. So palpation is just that. So we're palpating the area of a hurt body part, checking to see what's tender to the touch. So you want to start away from. So look, if this is somebody's, oh gosh, if that's somebody's hand, and their pain is here, you don't want to just press right there, right, to start out with, because everything's going to hurt. Start here and work your way up, work your way around, and get closer to the injured body part. Nice work with that hand, right? So start away from the injury and then move towards it. What we're checking for with palpation, so we're looking for symmetry, we're looking for tenderness, can be abbreviated as TTP at. So crepitus is a crunching sensation. Hyperthermia is that increased body temperature and swelling. So range of motion is the next step, and that's the easier range of motion. So basically, each joint has a certain motion that it can do. If you go into any higher up school, athletic training, physical therapy doctor, use something called a goniometer. That's extra credit number 2. A goniometer is something that specifically measures the degree of range of motion each joint can do, right? Like, so for shoulder flexion, it should be 180 degrees. If it's less than that, then something could be up with that. But for us, we just check it bilaterally, and the healthy side should be just as good as the other side, okay? Always do bilaterally. Strength is next. So the main one we'd focus on is resisted range of motion. So basically, you test the range of motion, now you can test strength. So you support the joint. So the rules support the joint. And then 2, no more than one joint away. And you test the strength, right? As you can see here, they're testing hip abduction right there. Special tests we really won't get into too much. We do that more in advanced sports med, but you're testing for ligaments. You're testing for look like right here. That's called Lockman's special test. They're testing for the ACL. There's some special tests for bones, like a bump test and a squeeze test. Neurological, so you got dermatomes, sensation, myotomes would be like muscle function, and then reflexes. And then from there you come up with a treatment plan and long-term and short-term rehabilitation plans and treatment plans. And that's the basic evaluation process. Let me know if you have any questions.